Whenever I come downtown Victoria, I feel this tension between those of us who have an addiction and between the city who has displaced us and who has made our lives just a little more difficult by taking our deepest issue and sweeping it under the rug.
The first fixed site needle exchange opened in Victoria in around 1987, and it was designed to provide clean needles to people that were using drugs to prevent the spread of HIV.
Needle exchange services and supervised injection services are part of primary care, and they're endorsed as health promotion, health protection strategies by the World Health Organization.
Like many people in Victoria, I use injection drugs until May of 2008. There was a small fixed site where I could go to get the things that I needed to protect myself from myself. I knew this site was it was overwhelmed. There's people there all the time. I knew it was in trouble.
When the fixed site was on Cormorant Street, it was a huge problem in regards to these public disorder issues. So we would see lots of criminal behavior that stemmed in that location.
So around 10 or 15 years ago, we were distributing around 200,000 syringes a year. By the time the fixed site had to be closed, we were distributing around 800,000 to 900,000. And the same with the number of clients. We started off with around 150 to 200 clients. Now we have around 1,500 active registered clients. And over that time, there was no increase in funding.
Our needle exchange closed in 2008 due to some of the conflicts in the neighborhood of operating a needle exchange in a downtown neighborhood.
When I heard that the fixed site was closing, I was really scared and I was really angry. But I heard that there might be a new site that was going to open down the street. But then I heard that the community in that area, they were fighting against it. They don't want a service like that on their streets. They don't want people like me walking down their streets. They don't want people like me around. That really hurts. That really hurts. I found out that the exchange is going mobile and that they're not even allowed to go downtown between Blanchard, Yates, Chambers, and Balmoral. I remember when I found that out, I felt so rejected.
We had to transition to a mobile site in the absence of having any fixed site. And as a result, the numbers of needles that we've been able to distribute has actually decreased dramatically. People have reported to us that they are having more health problems like abscesses. They're feeling sort of really disconnected from services, and they don't have as many places to go as they did before the closure.
If you can imagine, you're out on a street, outside a van, and so it's also a very public space. So there's no opportunity to talk to people in a confidential way, and there's no way to immediately link them to other services such as a counselor or a doctor or a nurse.
Oh, it's cold. I try to access the mobile units. We cross paths, I guess, every so often. For the first little while, I didn't know where they were. I didn't know where to find them, but now I do. I guess one of the biggest things is that I don't get to see the nurse as often, and I don't get tested as often, and neither do my friends. And I'm really worried about them because I think that they've been sharing needles. I don't know if people in Victoria think that this is okay. Does the city know what's going on?
There have been so many reports that have not only called for supporting needle exchange, but for expanding it.
In 2001, there was a study done in Victoria called the RARE study. They recommended increasing needle exchange services by adding a mobile site. They said really clearly, add a mobile site, but not at the expense of a fixed site.
One thing I think that people don't understand is that if I could stop doing this, I would. I don't wake up every day looking forward to this kind of thing. I have an addiction, and there's a reason it's called an addiction. It's because I can't stop.
We have a medical issue that's criminalized and stigmatized. That's why we're treating drug use differently than any other health service. We want to be able to have support for people who have drug use that affects their lives in ways that they don't want it to themselves and to their family or community.
Drug addiction and mental health issues and homeless, those are problems that have to be solved in more social, medical sort of approaches rather than a traditional law enforcement perspective.
The recommendation in our report is for multiple fixed sites, and those fixed sites can be integrated as part of primary care services. If there's multiple sites, no one site will become overburdened.
Right now, the decisions or the situation is against all the available evidence that would prevent a public health crisis. If we actually want to move forward, let's make sure that we're not just handing out harm reduction supplies, but we're providing primary health care services for people with addictions.
I don't know what I'm gonna do. I just wish that the city would stop trying to ignore this problem.